This is part 2 of our 4-part series called Your Hearing Loss Has Baggage.
And today we're going to be talking about
Cognitive load. I've done the
I just want you to
beginnings
do all the
all.
work for me.
Hey everybody, this is Dr. Michael Squires.
And I'm Dr. Carly Squires,
And this is Dr. Squires Squared.
a channel where we have candid and casual conversations about everything audiology.
Not sure what audiology is? Hit the like button, hit the subscribe button, make sure to hit the little bell so you get notifications when we post new videos, and we'll talk about it.
If you remember from the episode previous to this one, we introduced our 4-part series called Your Hearing Loss Has Baggage. And throughout the series, we're talking about the different underlying factors underneath that hearing loss that can accompany that. And today we're going to focus on cognitive load. What is cognitive load?
So when we talk about cognitive load, it's important to know what cognitive load is. The research shows that the brain only has so much energy to use at a given time. And depending on how the brain allocates that energy will determine how efficiently the brain is able to work. So if the brain can't divvy up that energy well, then it's not going to work efficiently.
Right, and how that relates to what we're talking about is if you have a hearing loss and your brain is trying hard to pay attention to what is being said and you're trying to hear that information, then other areas of the brain may not receive that same attention that it needs.
And one of those really important areas to be concerned about is balance and gait, or our ability to get up and walk around. There's some really recent or important research from Johns Hopkins University that indicates that hearing loss is actually linked to a higher risk of falls. They found in their study that even a mild hearing loss can increase your risk of falls by 300%. And every 10 decibels of hearing loss on top of that will increase that 140% more. So that's not to say that you're definitely going to fall if you have hearing loss. What it is to say is that your risk of falls and injury subsequent to falls is much, much higher if you have untreated hearing loss.
Absolutely, and that is why we focus so much here on making sure that that information is given to our patients and that we can try to treat that hearing loss as soon as it is detected. We also do balance testing here so that we can evaluate not only what your auditory system is doing, but what your balance system is doing too, and make sure that as much as possible we can minimize those risks, minimize your risk of falls, but then also treat the hearing loss, which is going to go hand in hand.
And that's a really great point. We also work very closely with a vestibular physical therapist who can help patients to learn to, through some exercises, learn to mitigate some of those issues so that hopefully we can kind of reallocate the way their brain uses that energy and make them a little bit sharper or feel more in control.
And more safe. It really comes down to safety. The next topic we're going to discuss under this umbrella of cognitive load is listening effort. And we want to touch on just how much effort it really does take for you to hear and understand what's going on around you. This is something that when you have normal hearing, you don't think anything of it. You just go about your day, you hear and you engage. But when there's hearing loss there, and even when there's not really, your brain is putting a ton of effort and focus into hearing what is said.
I have several patients that are either teachers or professors that before they treated their hearing loss, they would say that they would be exhausted by the end of the day, because it takes a lot of effort to try to keep up with that classroom environment. And after being fit with hearing aids and appropriately fitting that hearing loss, that's one thing that they've always brought up is they feel sharper, they feel more in control, and definitely less exhausted by the end of the day.
My favorite example of that is a patient that I had tell me that he felt more on top of his game after being treated with hearing aids. And that was a game changer for him. He had a better experience just overall throughout his life and at his job because he was able to treat that hearing loss and reduce that listening effort on his brain. We're filming again.
This is cognitive load. That's what we're here to do.
Okay.
So one thing that you've heard us talk about over and over is the statistics related to untreated hearing loss. But what we think is most important for you to take away from this is most of those statistics in those research studies, or they're going to continue to do research to look at the fact that treating the hearing loss appropriately with modern hearing aids has been found in many cases to reduce those statistics or reduce those risks. As an example, the risk of falls has been shown to be reduced by nearly 50% just by treating the hearing loss.
Right, so it just goes to show that even though these statistics are not good numbers, it's not a fun thing to deal with, we do have something that could potentially be a solution for you or for the loved ones that you may know that are struggling with this. So I guess the moral of the story is get your hearing tested, have a balance evaluation, and just make sure that you feel safe and that you can hear, and we can prevent these things or try to prevent these things from happening in the future.
Yeah, it's like what you said earlier, it's all about safety.
Absolutely.
Well, thanks everybody for joining us for this episode, the part 2 of Your Hearing Loss Has Baggage, about cognitive load. If you like the content that you're getting, make sure to like and subscribe to our channel. Hit the little dingy bell so that you get our notifications whenever our new content comes out.
Yes, and if you have any questions, you can leave them in the comments or certainly send us an email at info@hearwv.com or give our office a call at 304-428-2403. Thank you.
Thanks, guys.